The 5th month of pregnancy is an exciting time for expectant mothers as their growing baby begins to take on more distinct human features and their body continues to undergo changes to accommodate their growing uterus. However, this time can also bring a range of symptoms and discomforts that can be both physical and emotional. In this video, we will explore the most common symptoms and discomforts experienced during the 5th month of pregnancy, as well as tips for managing and coping with these changes. By understanding what to expect during this time, expectant mothers can better prepare for a healthy and comfortable pregnancy. But before starting, we are requesting to you to support us by subscribing to our channel and share the video. Here are some common symptoms and discomforts to be aware of during this time. Heartburn and indigestion. Heartburn and indigestion are common discomforts experienced by many expectant mothers during the 5th month of pregnancy. These symptoms occur due to the pressure placed on the digestive system by the growing uterus and the increased production of hormones that relax the muscle between the stomach and the esophagus, allowing stomach acid to flow back into the esophagus. This can cause a burning sensation in the chest, known as heartburn. To manage heartburn and indigestion during the 5th month of pregnancy, expectant mothers can try the following. Eating smaller, more frequent meals instead of large meals. Avoiding foods and drinks that can trigger heartburn, such as spicy foods, citrus, chocolate, and caffeine. Not eating within a few hours of lying down or going to bed. Sleeping with the head and torso elevated to help prevent acid reflux. Wearing loose-fitting clothing that does not put pressure on the stomach. Practicing stress management techniques, such as deep breathing, meditation, or yoga. Back pain. The growing uterus and increased weight of the baby can put extra strain on the back and hips, leading to discomfort and pain. Additionally, the release of the hormone relaxin during pregnancy can cause the joints to become more flexible and less stable, contributing to back pain. To manage back pain during the 5th month of pregnancy, expectant mothers can try the following. Exercise regularly, such as walking, swimming, or prenatal yoga, to maintain good posture and strengthen the muscles supporting the back. Use good posture when sitting, standing, and sleeping. Use a pregnancy pillow or support belt to provide extra support to the back and hips. Avoid activities that put extra strain on the back, such as lifting heavy objects or standing for long periods. Take frequent breaks and stretch throughout the day to relieve stress on the back. Apply heat or cold to the affected area for pain relief. Shortness of breath. This can be due to the growing uterus putting pressure on the diaphragm, making it harder to take deep breaths. Additionally, the increased production of hormones can cause the respiratory system to slow down, making it more difficult to catch one's breath. To manage shortness of breath during the 5th month of pregnancy, expectant mothers can try the following. Practice deep breathing exercises to help improve oxygen flow to the baby. Avoid activities that can make shortness of breath worse, such as climbing stairs or exercising in hot weather. Avoid wearing tight clothing that can restrict breathing. Take frequent breaks and rest when feeling tired or short of breath. Use a fan or open a window for fresh air to help improve breathing. Constipation. Constipation is a common discomfort experienced by many expectant mothers during the 5th month of pregnancy. This can be due to the increased production of hormones, which slow down the digestive system, and the growing uterus putting pressure on the rectum. To manage constipation during the 5th month of pregnancy, expectant mothers can try the following. Drink plenty of water and other fluids to help keep the stool soft. Eat a high-fiber diet, including foods like fruits, vegetables, whole grains, and legumes, to help promote regular bowel movements. Exercise regularly, such as walking, to help stimulate the muscles in the intestines and promote regular bowel movements. Avoid foods that can cause constipation, such as dairy products and fried foods. Avoid straining during bowel movements, as this can worsen constipation. Try using a stool softener or taking a fiber supplement, under the guidance of a healthcare provider. Leg cramps. This can be due to the increased weight and pressure on the legs and feet, as well as hormonal changes. To manage leg cramps during the 5th month of pregnancy, expectant mothers can try the following. Stretch and massage the affected leg to help relieve the cramp. Exercise regularly, such as walking or swimming, to help improve circulation and reduce cramps. Avoid standing or sitting in one position for too long, and take frequent breaks to walk and stretch. Wear supportive shoes and avoid wearing high heels, which can strain the legs and feet. Get enough calcium and magnesium in your diet, as these minerals can help prevent cramps. Nasal congestion and nosebleeds. This can be due to hormonal changes that cause the blood vessels in the nose to become more delicate and prone to bleeding, as well as increased blood flow to the nasal passages, leading to nasal congestion. To manage nasal congestion and nosebleeds during the 5th month of pregnancy, expectant mothers can try the following. Keep the air moist by using a humidifier or by taking warm showers. Avoid exposure to irritants, such as smoke and strong odors, that can worsen nasal congestion. Use a saline nasal spray to help relieve congestion and moisturize the nasal passages. Avoid blowing the nose too hard, as this can cause nosebleeds. If a nosebleed occurs, lean forward and pinch the nostrils closed for several minutes. Breast changes. Breast changes are common during the 5th month of pregnancy as the body prepares for lactation. Expectant mothers may experience increased tenderness, swelling, and darkening of the nipples and areolas. To manage breast changes during the 5th month of pregnancy, expectant mothers can try the following. Wear a supportive and well-fitting bra to help reduce discomfort and provide support. Use warm compresses or take a warm shower to relieve tenderness and pain. Apply lotion or cream to prevent dry skin and itching. If leakage occurs, use nursing pads to absorb the moisture and protect clothing. Try to avoid using harsh soaps or detergents on the breasts, as this can cause skin irritation. The 5th month of pregnancy is a time of many changes and discomforts for expectant mothers. To manage these symptoms and discomforts, expectant mothers can try the tips and recommendations outlined in this video. If any symptoms become severe or persistent, it is important for expectant mothers to talk to their healthcare provider. Please don't forget to like, share and subscribe our channel and